Welcome, everyone, to the Kidney Corner podcast. I am your host, Craig. The Kidney Corner podcast is from a patient perspective. Our disclaimer is we're not healthcare professionals. However, we are experienced professionals. So, welcome once again. We got an exciting episode for you all today. We're going to be focusing on patient advocacy, also post transplant issues or struggles. Our host today, she is a kidney health coach with AKF. She also has a foundation and also a patient advocate. And she's well known around Atlanta. See a lot, doing a lot of great things around the city of Atlanta for kidney health awareness. I see her on social media everywhere, doing her thing, speaking to the people, helping a lot of individuals who are dealing with chronic kidney disease. And I had an opportunity to meet her at a American Kidney Fund event. Great individual, great person, bubbly spirit. Let's get into it. Let's give a warm Kidney Corner welcome to Crystal King. Hey, Crystal,
Hey,
how are you?
I'm doing great.
Good. Awesome. Awesome. Good to have you and welcome to the Kidney Corner podcast.
Thank you.
And after today, you're more than welcome to come back and hang out with us. I said this to another guest. I said, hang out with us on the corner. I said, I know that sound crazy,
Push corner.
but we just hanging out.
Okay.
We just hanging out. Welcome once again. I'm so excited about today. How have you been?
I am doing good. I'm doing really good.
Awesome.
Thank you.
Awesome. Awesome. I know you are busy bee. You busy. You all over the place. All over the place. So we're just gonna get right into it because I know the viewers want to know, and some of our viewers have, like me, have seen you in and around Atlanta, seen you in Washington, DC,
Yes.
representing folks like us,
Mhm.
which is awesome. We need more individuals like you. I will remain a foot soldier, and I'll leave that DC stuff to you all. I'm a little bit too radical.
No,
I'm a,
we'll
I'm
stay
a,
in.
I'm a little bit too radical. So I'll stay on the corner in the streets, help pulling the brothers and sisters up. So, but anyway,
Mm.
a little bit about your story because you were a speaker at the AKF event,
Mhm.
and very interesting story. Now, tell us about you said something about age of 14.
Yes. Yeah. I was diagnosed with kidney disease as a pediatric. I was in middle school when I was
Hmm,
diagnosed. Yeah.
okay, okay. What particular disease was that?
So I have glomerulonephritis. And I woke up one day incredibly swollen. My face was swollen.
Hmm.
I was unrecognizable. And I had some back pain. And we went to the Children's Healthcare of Atlanta. And it took about a week for them to come back with the diagnosis of kidney disease after doing a kidney biopsy.
Mm, okay. Wow, wow. So, what stage was it? Because as we know, it's 5 stages to chronic kidney disease. But what did they diagnose you at what stage?
That's a good question. So I did try as an adult to go back and pull those records that were archived, but the archive that we pulled was incomplete.
Hmm.
So we are unable to determine what stage it was. But I do remember them thinking it was more so of a, I guess it reminds me of what people would consider a kidney injury. And the reason why I say
Mm,
that is because the treatment was steroids. And it's my understanding that that's the kind of treatment they give you when they feel like there could be some recovery.
Oh.
And you know, and hopefully you won't have kidney disease anymore after this sort of treatment.
Consider like an acute
Kidney injury?
kidney injury.
I I'm thinking so, only because of the way that they treated it.
Mm,
I don't know for sure because the record was damaged. And
okay.
so we can't look at
Oh,
the record anymore. Yeah.
okay. So you don't know about, okay, because the record, there was some issues with the records. Okay,
Yes, we weren't
got
able
you.
to pull the records. And when I try to ask my mom has no idea. Like getting her to remember something that's like 30 years ago is just like not possible.
Just forget about it. Yeah. Okay. All right. We'll
Yes,
take whatever you got, Mom. Yeah.
yes.
We'll take that. Okay.
Mhm.
Gotcha. 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 So through your life, that adolescent childhood, you knew you had some form of kidney disease or something going on with your kidneys. When were you diagnosed as, okay, it's chronic now? It's CKD.
Yes. I remember feeling okay after that diagnosis, and then maybe about 4 or 5 years later, I felt the symptoms again. It was like senior week of high school.
Mm,
And I knew like, okay, this is kidney related. And so I went back to the hospital. This time I went to like the local hospital and they did confirm that it was the kidney disease. But there wasn't really any treatment or cure, you know, for kidney disease. And so I wasn't really given any medication or anything, any
mhm,
instruction really on what to do other
mhm,
than to have a low sodium diet, you know, just be healthy, be active, you know, those sorts of things, but not really anything to do to like stop or slow the progression, like medical wise,
right.
you know, medication wise.
Right.
Not really given anything.
Mm,
And I was also still under the care of my mom. And so it wasn't until I graduated high school and college and got my own insurance that I kind of took charge of my health, and found a nephrologist who I trusted and who would answer all of my questions. And that's when we tried to pull that record from Children's Healthcare of Atlanta and found out that it
mhm,
was incomplete. So I don't have much information about my prognosis when my parents were in charge of it.
mhm.
I know more about what happened from like age 25 and beyond.
Wow. Okay.
Mhm.
Wow. But that's, I mean, that's big of you and mature of you to,
Mhm.
really take charge. As you were speaking and talking and really going back in time, talking about, from middle school to high school, then to college. What
Mhm.
was life like as a child,
Normal.
dealing with it was normal. Okay.
Normal.
It didn't
I
slow you
did
down.
everything I wanted to do. There
Okay.
were no changes to my life. I traveled extensively. I, you know, lived the life that I wanted to live. Like I, you know, ate whatever I wanted to eat for the most part. I tried to keep in mind, you know, that things should be low
Mhm,
sodium, and drink bottled waters or distilled water. I tried those things,
mhm.
but there wasn't really any effect that the kidney disease had on my life. And that's why I think it's important for people to understand it is a silent killer. There are no
Mm,
side effects. I'm thinking over here that I must be fine. I must be doing great. But really, like you said, there's 5 stages of kidney disease, and stage
mhm,
5 is the worst stage, which is kidney failure.
mhm.
And you could be thinking you're doing great, and you could be in kidney failure or, you know, progressing to kidney failure and have no idea. So I
Right.
would recommend anyone who's at stage 1, 2, 3, to be on top of it because just because you feel great doesn't mean that your body is doing great.
It's interesting you say that because, I stopped saying it's silent.
Oh,
Yeah, I stopped saying it. Now, it's
mhm.
fine that you said it because it segues into what I'm about to tell you.
Okay.
Knowing what I know today, because I was the same way. I did not know. I didn't. You don't feel anything. Your back don't hurt. None, no pain. Nothing. You feel normal,
No,
right?
those symptoms are usually at stage 5. Like, people ask me all the
Hmm.
time, like, "How do you know?" or "How did you know?" When you start feeling those symptoms, that's the last stage. Like, you
Right.
don't wanna wait until you feel it. You want to
Right.
be
Till
on
you
top
feel it. Right.
before you
Right.
feel it. Yes.
Exactly. I agree with you 100%. Um, but I'm starting to I changed my verbiage now, or my
Okay,
messaging. My messaging now is, it may seem silent. I don't think it's silent, but I know it's whispering.
okay.
That's what I'm saying, because sometimes you may hear somebody whispering, but it's not clear to
Mhm.
what they're actually saying. So
Okay.
there are signs, there are some symptoms there, like monitoring your blood pressure.
Blood pressure. Mhm.
Yeah, yeah. So if it's elevated out of whack, we
Mhm.
gotta pay attention. That's a whisper.
So I will say, so one of the side effects of kidney disease for me was high blood pressure. So I
Mhm.
was on a medication for blood pressure throughout this time. Um,
As a teenager.
More so in my 20s when I kind of took
Okay.
charge of my health. I was,
Okay.
yeah, as a teenager, I was really not on any medication at all.
Do you think
Hmm.
you should have been on a blood pressure medication in your teens? Hi, my name is Craig Merritt, founder and executive director of the Get in Position Foundation, Inc., and I'm also a kidney transplant recipient. I personally know what it's like to face kidney disease, and no one should face it alone. So I'm asking for your support by donating to this needed cause. So visit our website at www.getinposition21.org or by scanning the QR code on your screen. By partnering with us, you will be providing hope and delivering guidance to those who need it most. So let's all get in position as it relates to our health. Thank you in advance.
I don't know because I don't know what my blood pressure was like. I have no
That's
idea.
a good answer.
Hmm.
Right, because you did not know. Oh
Yeah.
wow. Oh, okay. Because I guess where I was going, how do you feel about, you know, teenagers, or anyone over the age of 10, I guess,
Hmm.
12, 13, being on medication?
I think
What's your thought process?
if the doctor tells you to be on the medication, that you probably should be on
You
it.
should be on it. Okay.
And if you don't agree, I think you should get another opinion.
Hmm.
Um, but I think that, people need to follow doctors' orders, instead of, just doing what they want to do. Um,
Hmm.
I know a lot of African Americans that find out that they need to take high blood pressure medications, and they think that they can just change their diet and go to the gym. And my advice is always, you can do that, but take the medication and do that. And then when your levels get to a number that your doctor agrees with, you can come off of those medications. I rather you be on them than not be on them, because when your blood pressure is high, when it's elevated, it's pumping, and it's working so hard that it's
Hmm.
putting a lot of stress on your kidneys, and having high blood pressure can cause kidney damage and kidney failure. And so I wouldn't wait until you feel like I've worked out enough and I've changed my diet enough. I would take the medication and do the diet changes, and the exercise, routine, and let the doctor tell you that your numbers are well enough to come off the medication. Number two cause of kidney failure is heart issues.
Yep. Yep. Which high blood pressure has everything to do with that.
Correct. Yeah.
Everything to do with that. Congestive heart failure, those things, absolutely correct.
Mhm.
So you took charge of your health at that time. Um, when you did, what was the breaking point? Because today you are a post transplant or transplant recipient,
Yeah.
so there had to come to stage 5 for you.
Yes. Hmm.
Unfortunately, was there dialysis? What led to that point of dialysis?
Yes. So pregnancy is the cause of my kidney failure.
Hmm.
The older you get as a woman, you're at a higher risk, of having a difficult pregnancy. It's considered a high risk pregnancy. So I was 36 years old when
Hmm.
I got married, 36 years old when I got pregnant. And so even if I didn't have kidney disease, I was a geriatric pregnancy and a high
Hmm.
risk pregnancy.
Hmm.
When you combine that with kidney disease, I'm at an even higher risk of pregnancy. And pregnancy takes a toll on the female body. It can exacerbate, all of your organs, but if you have kidney disease, it can, make your kidney disease worse. So if you're at a stage, I don't know, 2 or 3, you could end up at a stage 5 by the end of the pregnancy.
Mm.
And so the pregnancy sent me into kidney failure.
And not to mention, you're coming into the pregnancy already
Yes.
with kidney issues. So we got to be very, very mindful of that. Oh
Yes.
wow. Okay. Okay. So
I don't recommend getting
yeah.
pregnant if you have kidney disease, or if you are going to
Wow.
be pregnant, I recommend that you do it earlier in your disease, at
Mhm.
a younger age. So kidney disease gets worse over time. It
Yes. Correct.
progresses over time. And
Correct.
so the longer you wait, the worse your kidneys are, the more of a risk you are, of develop or of going into kidney failure.
And that's important to know. I'm glad you said that
Hmm.
because for individuals, our young people out there,
Hmm.
um, who are because we're starting to see more young people getting married and
Hmm.
wanting to have a family,
Hmm.
and have children.
Hmm.
I would even go a step further. Even if you do not have kidney disease, I would suggest go the extra step and
Hmm.
getting tested.
I would too.
Yeah, get
Mhm.
tested. If to see where your kidneys are,
Yes.
to see
Mhm.
the function of your kidneys. Don't say I ain't gonna worry about. I'm good. Nobody said anything. No, be intentional about that. Be
Yes.
very intentional. I'm glad you mentioned that. That's
Mhm.
very, very important. So preventative care.
Mhm.
We want to take every measure
I
to
agree.
be safe and to be healthy and to be
Mhm.
well. Not just for the individual, but for the family,
Yes. Mhm.
because this thing affects everyone.
It does.
It
Mhm.
affects the whole tribe, the whole village.
Mhm.
Yeah, yeah. So after your child was born,
Mhm.
that's when they discovered that it declined and it was what time for dialysis.
Well, they
I'm assuming.
actually told me, that I needed to look for a living donor and to get on the transplant wait list.
Okay.
Um, yes, and so that's what I did. I was also told that because you just had a surgery, a major surgery, which was a C-section,
Mm.
that my body has to heal and recover from the surgery, and that my kidney function would likely improve a little bit,
Mm-hmm.
um, because I had to recover from the birth and delivery of my son. And so after that, I was told, well, we have a little bit more time. Like, you don't need to start, dialysis yet. You don't need to get a transplant yet. But I personally felt like death. Like, I thought I would die, like,
Mm.
at any moment. I felt like I wasn't being listened to, when I would describe, like, my extreme exhaustion, and
Mm.
all the complications that I was dealing with. So I went to art school. I know a little bit about photography. I went out and purchased a camera and I started documenting my life with my son.
Nice.
Mainly because I wanted him to have memories of us together because I really thought like I would die soon.
Wow. So this is going on in your head, in your mind, and you're taking action. Oh, wow.
Hmm.
Okay.
Yeah.
Okay.
I started documenting our life. I did it on Instagram, Facebook, and one of my friends suggested that I share my kidney story, which I was really hesitant to
Hmm.
share because, like, really no one knew that I had kidney disease except for like my close friends and family.
Hmm.
I didn't really want to talk about it publicly, but and also like in my family, no one talks about illnesses publicly. I think it's like more accepting now, like after the pandemic, but before, like nobody was really, raising awareness and speaking about these things publicly. And so I started, talking about what I was experiencing. I started sharing like all of my doctor's visits,
Hmm.
all of the notes from the visits, all of my labs, what the results were.
Hmm.
And I feel like people like literally had like a front row seat to my demise. I really do, because like it was getting
Wow.
worse and worse and worse.
Oh, goodness.
Like I was sharing like daily and it was like getting worse. And
Wow.
what I learned is that kidney function, the way that they calculate it is based on an EGFR calculation, which at the
Hmm.
time was based on race. And
Hmm.
so if you were African American, they had an accelerator that would say that your kidneys were functioning better than they were. And so I believe that I probably needed a transplant, um,
You did
right, when I felt
when they
like,
told you.
yeah,
When they told you you needed it. When
yes,
they told you you needed it right then and there.
I needed it right then and there. But they made me wait for 3 years because of the EGFR calculation said that I didn't need it. Yeah,
See, and I'm glad you because I was going to back up and talk about the EGFR calculation, and
yeah.
you touched on it, because fortunate for me, I was on dialysis for 4 years,
Hmm.
and January 3rd of 2023 was when they changed that policy, and the mandate went out to all transplant facilities. You have to readjust everyone's time. And
Hmm.
so, because that's the same year I received my transplant.
Good.
2023. But just for the folks listening, when we begin to talk about this healthcare system,
Hmm.
and the culture for black and brown people,
Yes.
it's a real thing, folks.
Yes.
It's, I mean, to have a calculation, a
Yes.
racially biased calculation to say, all right, because you're black,
Mhm.
because, and that's based upon what you check when you
Yes.
fill out the form.
Correct.
Now the blood, now there may be some things in the blood that might say, okay, yeah, African American, but yeah,
Well, race is a social construct, and so there are no differences between us. And so there should have never been a
never.
calculation that says that our kidneys are performing better than they are compared to white people or anyone else.
You know why that's so true? Is because my transplant that now you received a transplant from a donor,
A living donor.
a
Yes.
living donor, right? Okay. So for all the other people out there that
Mhm.
receive kidney transplants, now it could be from living donors that they may not know,
Mhm.
or it could be from a deceased donor.
Mhm.
So if there's a huge difference between races, why can't someone who's African American or someone who is white get a black person's kidney?
Mhm.
You see you understand what
Yes,
I'm saying?
yes, you can.
So
Yes,
so y'all pulling the wool over our eyes or what?
yes,
What's going on here? What's
yes,
really going on here?
yes.
Right? So that's why,
Medical racism. That's yeah, it's
it's
medical racism.
straight
Mhm.
up racism right there.
Yes.
So okay, we talked about that, but you mentioned something else about the family. And
Mhm.
I'll go as far as to say the black family.
Mhm.
That we don't talk about certain things.
Correct. Yeah.
Talk about that for just a sec, because you mentioned this when you spoke at the event.
Mhm.
Just hit on that just for a minute.
Yeah, so in my family, we don't talk about our health publicly, and I think in a lot of Black families, we don't talk about our health publicly. And so when I decided to share my story, there were a lot of questions like, why are you talking about this? And I have family members, who would say, like, they're asking me at the church, they want to know, like, what's going on with you? Like, why are you sharing all of this on social media? And so luckily for me, I don't know why I'm like this, and I'm not saying it's a good thing, but I don't care. I don't really care. Like, I'm gonna do what I wanna do. And so it wasn't really like it took a lot of convincing of my friend to get me to share my story publicly. Like it was, like I thought about it for
Hmm.
a couple of months. I didn't think about it for years. But I wasn't really worried about what the people at the church were gonna think about it. I really didn't care.
Right. It was your life.
Yeah. I
Your
felt
life.
like
Yeah,
I have
because
a child who I
hmm
need to survive for, and if I have to look crazy to be alive, I'm just gonna be looking crazy, and I don't really care what no one thinks about it. I really don't. Like, when you become a mother and you're trying to survive, so
hmm
that your child can have their parent in their life, I will do
hmm
anything. I will say anything, I will do anything, and if I look crazy, I don't really care.
hey, I'll just have to look crazy. You know what I mean?
Yeah. Mhm.
So let's fast forward. Got the transplant, obviously doing well. How many
Months
years in?
later I got the transplant months later when the program opened back up,
Okay.
and that was in 2020, so it has been 5 years since I got
Nice.
my kidney transplant.
Nice.
Mhm.
Nice. So let's talk about these medications, right? Because I saw again, seeing you on Instagram, still documenting your story,
Mhm.
your situation. Um, there's a there's a medication that you're on,
Yeah.
okay? And for those listeners and viewers out there, post transplant takes huge discipline, a lot of discipline, and a lot of responsibility for your survival. Right, a
Yes,
lot of medications, um,
yes.
because
I
there's a
think
pot.
it's easier than being on dialysis.
You say what?
I think it's easier than being on dialysis. All you're doing is taking medication twice a day, like, that's easier than being on dialysis.
Yeah, yeah. To some people, I mean, the thing is, I have learned there's all types out there.
I know, there's some people who rather be on dialysis, and I don't understand it. It's like,
Yeah,
I don't get
there's all types out there.
Mhm.
Um, yeah, to your point, there's individuals who rather be on dialysis, and really, for me, and we just interviewed someone who decided to stay on dialysis. It was convenient for them. They had a fear of the medications, and so um,
I have a fear
that
of dialysis. Dialysis shortens your lifespan.
yeah, yeah. I have a fear of it. I mean, not a fear of it. I just don't like it. And
Mhm,
so I vowed, I said, I'll never go back here. We're not going back. That's my
mhm,
decision. Right. So I
mhm,
must do the things I need to do. And I did the things that
mhm,
I needed to do, staying healthy,
mhm.
um, going to my treatments, doing, again, doing what I was supposed to do to get the transplant. But there's
Also,
individual
dialysis is like a permanent disability.
it
Like
Yeah.
It's so limiting to me. Like all the diet restrictions, like food, fluid, medications, feeling sick, having to recover from dialysis treatments, and you can't like get out of bed for an entire day. I don't understand why anyone would choose that over
There
transplant.
go, there go Crystal. She's like, I don't get it. I just don't get it. Damn it.
I don't get
Why,
it.
why you
I think people just get comfortable in their routine, even if their routine is sucks.
you and I have 1,000,001 reasons not to be on dialysis.
Yeah.
And there's somebody that's just got that one.
And you can get
Why?
infections, you could die, like your
She
port
just
can
added to the
things happen to your port and they you have to get them replaced, which is another surgery.
list. Crystal just can't, she just can't get up.
Sorry.
No, hey, hey, I said this in another podcast. Listen, you are hanging out on the kidney corner. So it's all types of people that's on the corner. It's
Yeah,
all types of people. And
yeah,
some people who is like, no, no, I don't understand. And then there's the other person arguing their point as to why they believe what they believe.
yeah,
Trust me, I'm a city dude. I'm from Brooklyn, New York. So I've seen all types of people
yeah, yeah, I'm just
go,
confused.
going back and forth. But it's okay. All are welcome on the kidney corner. But
Yeah,
I'm not disagreeing with you. Don't get me wrong. I'm not disagreeing with you because I can't see it either. I really can't see it either. For me, it's just a better way of life. Um, Again, to your point, you shared your story. I also shared my story. I don't get it either, Crystal. I really don't. But that's just how some people feel. They become complacent. Um, they really do. They become comfortable. Uh, it is to me. It's short term. It
yeah,
is short term.
it is.
That's why they push transplant
Mhm. And
to
what is the end result of dialysis? Death.
is death. That's it.
You
That's it.
don't
Because it's gonna
live
get worse.
on dialysis.
Yeah, because that long term pulling, pushing,
What
pulling.
it's doing
It's
to your body.
what
Yeah.
it's doing. It's wearing you out. It's wearing your body out. So
Mhm.
yeah. So we were talking about the medications, right? And also to your point, the restrictions.
Mhm.
Why not be free?
Yes.
The fluid restrictions, the food restrictions. I don't know about you, but the day after my transplant surgery, they was like, eat whatever you want,
Yeah.
go crazy.
Yes.
And this is the funny part. They said, especially dairy food,
Mhm.
because my phosphorus was very low. I mean,
Yeah.
all time low. So they was like, yo, you got to bring that up quick. Um, which I had to kind of get used to a new normal.
Yes.
It was a little tough for me. How about for you? What was it like for you?
After I had I was sick for so many years to me. I
Mm-hmm.
was sick for so many years that I forgot what it felt like to be healthy. I remember
Mm,
like walking to the stop sign in my neighborhood, which is only like maybe 4 houses down, and being like, wow, I can walk to the stop sign? Like, wow. Like I could ride bikes with my son. I could go to the trampoline park and actually jump. A lot of parents, when they go to the trampoline park, they don't buy a pass to jump. Like they just sit on the sidelines. But after getting my transplant, I got like this new like zest for life. Like I'm 44 years old, but I'm jumping on the trampoline, I'm getting on the bike, I'm getting in the pool, I get in the bounce house, I'm getting in everything that my child is getting in. And most people my age, like I said, they just sit on the sidelines and take life for granted, I
For
think.
granted. Yeah,
Yeah.
you never know how good life is
Yes.
until it's in jeopardy.
Now every day is a vacation for me. Like
Yeah.
I have this motto, celebrate life daily. Like I live every day like we're on a vacation. Like, and that doesn't mean that we're going on a flight and out of town, but like,
Right.
what do you want to eat for dinner? Like we don't have to be confined to eating here. Let's go get hibachi. Let's go get whatever you want. Like,
Mm.
like life is short. I value life so much more. Like I do a lot of things during the week. You want to go to trampoline park? We don't gotta wait till Friday. We can go today. It's Tuesday. Let's go. Like we do things that other parents probably would not do in the middle of the week.
Mm.
If I want to go see a waterfall, I'm going to see the waterfall in the North Georgia mountains. Like we have a lot of fun experiences.
That's
And
awesome.
I don't, it's not like a once a month thing. Why can't it be once a day
It's
or a
every day.
couple of times a week? Or, like I don't wait for big moments to do things because when you have to face your mortality, it changes your whole perspective. And I hate that a lot of people have to be in that position for their perspective to change. If there's one thing I could do, it'd be like wake everyone up and let them know, like, you have an amazing life. Like, I feel like a lot of people, like, they have what they consider problems, and, they're talking to me and telling me their problems. And I'm like, who cares about all the stuff you're talking about? Like, these are not problems. You're alive, you're healthy,
Mhm.
you can walk to the mailbox, or you can do things. You don't have limitations on things that you eat, things that you drink. You're not tethered to a machine. You're not laying in
Mm.
bed all day because you're exhausted. Like you have life, but this person over here is says something mean to you, delete them, like move forward. Like
Right.
who cares? Life is
Mhm.
short. We don't have time for this.
Wow. And now I'm really getting a sense now, because I just after the event, I just spoke to you briefly about a situation that I had, and I wanted your input on it. But let's go back to the medication piece
Hmm.
because you know you're on these pills, you're on these medication, immune suppressant medications. There are different types.
Hmm.
Some of us are on one thing, some of us are on another thing. Now you were on one particular medication, and you did a video about it. Talk about that situation for us.
Yeah, so after you get a kidney transplant, you have to take immunosuppressants. And these are medications that are designed to lower, weaken your immune system. And the reason why you have to take those is because once you get a transplant, that's a foreign object, and your body will attack it the same way it would a cold or any other kind of virus. And so your body is going to attack this organ for as long as you have the organ in your body. And so, in order to prevent your body from attacking the new organ, you have to take medications to lower your immune system. The downside to that is that you can get a cold, flu, any other kind of illness, virus easily.
Mm-hmm.
And so, we're taking these immunosuppressants. There are several different types of immunosuppressants that you can take, and it's really up to the facility where you get your transplant at to determine like what medications they're going to put you on. And so I got my transplant at Emory, which is also a university as well as a hospital. So it's a teaching school. And I'm glad that I got it there because they are a little more ahead, cutting edge with the
Mm-hmm.
medications that they give patients who have gotten transplants. And so one of the medications that they put us on is Belicept. It is a monthly infusion. We take that in place of tacrolimus, which is the medication that most other hospitals give their patients.
Mm-hmm.
And we do start on tacrolimus, but we're only on it for maybe 6 months to a year because tacro has a side effect of kidney damage. And so they don't want their patients being on tacro long term. They want us to be on Belicept instead. And so Belicept is a monthly infusion. It's only about 30 minutes, but you could be there for hours depending on where you get it done.
Hmm.
When I was getting mine done at Emory, I feel like I was there for 3 hours every time because you have to wait to be called back, which I feel like I will be in the waiting room for almost an hour. And then they
Wow.
call you back and then they have to order the medication. Like it's not just sitting there waiting for you. It's based
Right.
on your height, your weight, it's based on your stats for that day. And so they don't, have that information until you have been weighed in after you have been called back. And so then they can put in the request for pharmacy to mix the medication specifically for you. And then when it finally arrives, it's like a 30-minute infusion. And then you may wait a little bit afterwards or not, and then you go home. But I feel like for me, there's like no side effects or issues with Belicept. And so I love being on Belicept. It's a little disruptive in that you have to go once a month. Um, and Emory is a little further away, so they do have a program called like Bella in the Community, where they'll help
Mhm.
you find an infusion center that's closer to you that may not be affiliated with the hospital, but they
Mhm.
can send the lab order there and you can get it done closer to home. I've even heard some people say that they get Bella done at their home. So there are some
Wow.
facilities that can administer it in your home if that's something that you qualify for.
Wow. Sort of like a Uber Bella.
Yes.
Maybe we can start that.
Yes, I don't know, I really
You want
like
to,
doing Bella. Yes.
cool, cool, awesome, awesome. Because I shared with you that tacrolimus also too. Not only does it cause kidney damage,
Mhm.
it also it along with the other medications that you're taking, because that's not the only uh, immune immune suppressant medication that you're taking. You're taking probably three others or two others. That mixed with that, it's all chemistry. It could raise your blood sugar level,
Mhm.
and they know this.
I did not honestly, like, when you told me that, I was like, add it to the list of reasons why I don't like Tacro. Like,
Yeah,
I did not know that it was doing that to you. I had no
yeah,
idea.
yeah. I'm not a diabetic. No one in my family history is a diabetic. Um, and Tacro has raised my blood sugar level. And I am today a type 2 diabetic based upon my A1C. It's
Just from taking
all,
medication.
yes, it's all medically induced, right?
Mm,
I've done every single thing because I was disciplined, with my renal diet. Okay, I can be disciplined with a diabetic diet, but it did not change anything. I mean, I cut out everything, all the starches, no potatoes, no bread, no, none
mm.
of that. You know, no sugar, drinking water,
How
this
you
that,
did that.
and so the the problem that I had was they were trying to put me on. When I say they, I'm talking about the doctors, the healthcare professionals, wanting to put me on several different diabetic medications, right? To
Mm,
combat this other stuff. And I'm like, no, you
right.
you guys know what and who the culprit is.
Yeah.
What can we do different? So I want to, what wound up happening was I had to advocate for myself and demand it.
Mhm.
I had to demand, let's do something different.
Yes.
And I also said, no, not taking that or that, because
Hard to do.
that,
It's
what you
hard to
say?
do. That's hard to do, to stand up to your doctor and say, "We gotta switch medications. I'm not interested in this medication anymore." That's hard to do.
Okay, so like how you were, which trying to understand why people don't get a transplant, it's not hard to do for me. It for
It's
me,
not hard to do for me either, but I'm just saying, like,
Right.
I've
I,
learned
yeah.
people are not gonna speak up for themselves. They feel like the doctor went to school for all these years, they know what they're doing, they wouldn't put me in harm, but it's literally called the practice of medicine. They are
Say it
practicing on
again.
you.
Say
They're
it again.
practicing.
Yes. It's a practice because think about it, folks. It's not just me and Crystal talking to each other, having a conversation. We're talking to you all out there, right? Watching this and listening to this. Some of you, and probably the majority of you, are on blood pressure medications, right? When they first told you you had to have be on blood pressure medicines, how many blood pressure medicines and how many different doses did they try until they got it right?
Right.
You
Right.
dig? So they practicing.
Right. And how many
We
brands they switch? Yeah.
that part. So to your point, Crystal, it's it's a practice.
Yes.
And what individuals don't understand is you have patient rights. You
Yes.
have rights as a patient.
Mhm.
You have to stand up for yourself.
Yes.
And now to Crystal, to your point, because in the beginning you mentioned, take your medications, comply, this, that, and the third. I agree with that. I do agree with that. I
Mhm.
agree with you. I'm not here to debate or argue with that point, right?
Yes.
However, because we got to be careful, right? Because somebody up out there might be saying, "Oh, Crystal, on the corner, they said, on the corner, no, the podcast on the corner, they said, you know, I ain't got to take the medicine." No, we didn't say that,
Yeah.
right? Because some people will be saying, "Well, I ain't got to take it if I don't want to." No, we're not saying that. I'm
No.
I'm not saying that. It's because Craig had an understanding of what was going on with him and his body. Not a diabetic,
Mhm.
never been, no one in my family history, right? I understood that.
Mhm.
I understood because I did the research
Mhm.
on all of these medications that I'm on. I'm looking at, okay, what this do? What are the side effects of this?
Yes.
Putting the work in. What's your thoughts on that?
And not only that, talk to your doctor about it. And so your doctor understood, your concerns. He understood what you were doing. It's not like you just pulled the plug on and stopped taking a medication. And so I think that's important to note as well.
Yeah.
Um, because you don't want to just stop taking medications and have like some really bad things happen to you. And also, you don't want it to be listed in your chart that you're non-compliant. Um,
Mm,
because if you're on dialysis and they give you medications and you decide, oh, I don't like this medication and I'm just gonna not take it, or I'm not gonna take the full dosage, or even with dialysis treatments, I gotta go pick my kid up from school. I gotta leave 30 minutes early, an hour early, and you're cutting those treatments short. And I don't know, like I am a compliant patient, but I would imagine that the dialysis tech and whoever these people are that you're having these conversations with about medications that you don't like, they're probably just like, okay, girl, like they're probably not telling you like this is extremely terrible, like you shouldn't
right.
do this. Like they're probably just saying, okay, it's your choice. But what you don't know is that they're going back and writing in there does not take medication as prescribed, does not take the right dose, left early. And so when you get, painted as a non-compliant patient, it becomes difficult to get recommended for a transplant because transplants are only for people that follow the rules. They're only for people that are compliant. They're for people who can prove that they will take medications when they're supposed to take them, because there aren't that many kidneys out there. And they
Right.
don't give it to someone who's going to be an organ rejection, within the same year of them giving it to you. They rather give it to someone who is going to take the medications, because you do have to be on these medications for life or for the life of the organ. after you get an organ. So they're looking for people who are compliant. And if you're having issues with medications, I would have conversation with your doctor, let them know the issues that you're having, suggest some alternatives. If you know some alternatives, see if they will write you a prescription for something. But you definitely want to have a conversation with them. Like you don't want to stop cold turkey and then you end up,
Hmm.
in organ failure.
Right, right. Yeah, yeah, I agree with you 1000%. So this video I saw online with you talking about the Belicep.
Yes. So I ended up getting I have the same insurance, but the plan changed. The plan somehow changed. And it no longer covers my Bellacept treatments. And
Mm,
so the Bellacept, is a few $100s a month is what they were wanting me to pay for this medication. And I was kind of in a position of like, oh, am I going to have to take tacrolimus now? Am I not going to be able to be on Bellacept anymore?
mm.
And so what I did was the hospital that I get the medication from, they have a financial assistance program that I was
Nice.
able to apply for. And so they're covering my Bellacept treatments for now, which I thought was only going to help me for 1 year. And it recently expired, but they let me apply again. And so, yes, I'm so happy that I can still be on Bellacept because I really don't want to switch medications as this is working for me.
And I don't want you to switch. I
Yes, it's a
I
little
I'm in your I'm in your corner. So
yes.
no, no, because
Mhm.
since our meeting and our talk, I had my first infusion last week
Good.
and it went well.
Yeah.
So they're tapering me off of the tacrolimus,
Mhm.
which I will share with you. You're the first to notice.
Yes. Good.
My also my monitoring my sugar levels have been totally different
Wow.
since the first taper.
Wow.
I can tell a difference already. And one of the things that I also teach my mentees is that it's the business of you.
Mhm.
It's Craig Enterprises LLC.
Yep.
This
Yep.
medical team, Doc, your partner.
Yep, and you could get fired, you know?
Say it again.
So if your doctor is not someone who you feel like is a good teammate, you need to find another one. Find one that you can have these conversations with. Find someone who you can talk to. Find someone who you can trust. There's other options. Like if the one that you have is not serving you, find somebody else.
Interview. Whole
Mhm.
whole interviews.
Mhm.
Whole interviews. Um, let me see your resume.
Mhm.
Just because you got
Yeah.
MD back there, so what?
Mhm.
Let's get some references.
Yeah.
Anybody else know this doctor?
Mhm.
How have they been? What's their bedside manners? There's certain things that's important to me. How do they treat their patients?
Mhm.
You know what I mean? What's their approach to treatment?
Mhm.
Are they always writing a prescription just off the back?
Right.
What? What?
Right.
Maybe we'll do something, another podcast on the things to look for when
Yes.
hiring a healthcare professional.
Yes.
It's
Yes.
important though, Crystal. It's
Pick the right
important.
person. Yeah,
The right individual that fits you.
it is.
And I'm past. This is something I will say. I'm not ashamed to say it here on the kidney corner because we on the corner, whatever we can do, whatever. So I'm past this black thing.
Oh, yeah.
I'm past. Yo, I'm looking for a black doctor. Blah. Blah. Yo, I am past
Mhm.
that. I need the right doctor.
Yes.
That's the
Yes.
color I'm looking for.
Yes.
The right
Mhm.
doctor, male, female, whoever, old, yeah. Is it the right? person.
Mm-hmm.
Let's test you out.
I agree.
It's because why? It's my
You need
life.
someone who you can talk to and someone who listens to you and someone who you trust.
Absolutely.
Someone who
Absolutely.
answers all of your questions, someone who doesn't rush you out the door like, "This is annoying, I don't wanna answer, these questions." You need someone who is gonna answer your questions.
Right. Exactly. And don't give you attitude.
Yeah.
Like if you asking a question, well, why you keep at wait, whoa, wait a minute.
Mhm.
Time out.
Mhm.
Okay. And be nice about it. To
Mhm.
your point, Chris, you said they could get fired. They
Yeah.
can. You could get fired. I've done that a couple times
Mhm. And
and
they can
said
fire you too, so that doesn't mean you can be walking in all crazy, but yes.
right. Exactly. Exactly. I like the point that you made about things go on your record.
Yes.
I
Mhm.
I like I love the way that you brought that up because people don't realize
Mhm.
that things are in your medical records.
Yes, and you in there laughing and joking and thinking it's all good, and they laughing with you, but they are writing something different.
Yes. And to that point, did you know, folks, that you had the right to request your medical records
That's right. Mhm.
and to see what's in it,
Mhm.
especially dialysis patients in center dialysis patients. I will say that because that's where I was. I was PD, then hemo in center. Um, you have the right to see your medical record.
Mhm.
What are they writing in there?
That's right.
You need to see that, and you can request that. A
Mhm.
lot of people don't know.
Mhm.
So you are an executive director of a nonprofit organization. And so talk about your nonprofit organization, the Kidney Champion Foundation. What do you
Yes.
guys do?
Yes. So we educate, which is probably exactly what it says on the screen. I have it memorized. We educate historically marginalized communities about kidney disease while fighting for inclusive and equitable access to care. And so we do that through like free community education at local libraries, churches, community centers. We'll even come to your home if that's what you want, corporations just to stop, prevent the progression of kidney disease. We also go to DC every couple of months. We meet with our state representatives, senators on the federal level to ask for them to support different kidney policies, which they do that by sponsoring or co sponsoring a bill. Also, we ask for appropriations, which is funding for certain things, to support kidney patients. And yeah, I mean those are kind of like the big things that we do.
Okay, great. And for those who are listening, um, the website, we do have it on the screen, those who are watching. But those who are listening, we have it on the screen, www.kidneychampions.org. If you want to go there, donate to this great cause and organization that Crystal has. The Kidney Champion Foundation. Great, awesome. So I'll ask you this question and then we'll wrap up. Going to DC,
Mhm.
speaking to state representatives. Again, we on the corner, so we down home. Do they listen to you? What? Are they just politicking? What's going on? How does
Um,
that go?
yeah, it's really, really easy, actually. Anyone can do it. You just schedule a meeting with your senator, your representative, and you have a conversation with them about, you know, your illness. If you have kidney disease, if that's your cause, if that's what you want to talk about, you just go and you talk to them. And then at the end of it, you can ask them to sponsor whatever it is that you want them to sponsor. So one thing, just to give a quick example
Hmm.
of how I would do it, if we were talking about the Living Donor Protection Act, I would say, which is already passed in Georgia, but if I was in another state, I would go and meet with them and I would say, "Hi, I'm Crystal King. I got an organ, from my cousin, my first cousin. She donated her kidney to me, and I would love for you to co-sponsor the Living Donor Protection Act. And the reason why is because we don't want donors to face discrimination from giving organs. My cousin was able to donate to me,
Hmm.
and as a result, I'm no longer a strain on like the Medicaid or Medicare system. I'm not
Hmm.
on dialysis. I'm healthy. I'm happy. I don't have a permanent disability. I'm able to go to work every day, and we want more people to have that opportunity through getting an organ donation. But unfortunately, when people donate their organ as living donors, they could face some sort of discrimination. Like they may donate and they may come back to not having a job because maybe they
Right.
didn't have FMLA or maybe they didn't have any kind of job protection, or they may face some kind of insurance discrimination. And so that deters people from wanting to donate, but we need more people donating organs. And so you just kind of tell them your story, tell them what you want them to support, help them understand why, and then they're more willing to to want to support it or understand it. And so getting someone to support something, they may not support it right on the spot. They may need to see some facts, some figures, some numbers. They may want to talk with other their colleagues, other people. They may ask you like, well, what other senators have supported this? What other representatives have supported this, so that they can have conversations with them to figure out how they supported it, why they supported it, how they can
Hmm.
work together to kind of like, support it together. And so they may need more information. So you usually don't walk away with like a, yes, I'm doing this. Um, at the end of the meeting, but you're just kind of having this conversation and like, oh, it's me again, talking about this again. You may have to have the conversation like several times, like throughout a
Wow.
yeah,
Wow.
in order to get
Okay.
them to support it, but you just wanna really, like, build that relationship with them, like, get, familiar with them and have them get familiar with you, and it's like, "It's me again," and hopefully, like, if they have questions about kidney disease, they know she comes in here and she talks to us about this all the time, so if we have questions about this other kidney bill or whatever, like, we know that we can reach out to her and she may be able to answer some questions. Or if you have like an organization behind you, like whether it's the American Kidney Fund or the
Right.
National Kidney Foundation, um,
Hmm.
they can provide that, additional data that may be needed. A lot of these large kidney organizations, they're looking for patients. They're looking for patients to come in and share their story. Because when
Okay.
it comes to getting changes made,
Hmm.
senators and representatives, they need to hear from their constituents. Constituents are people who put them in office, people who they represent. So, like, for example, my senator is more willing to hear from me than someone who lives in another state. Like, of course, they'll hear from
Right.
everyone, but they
Right.
want to hear from whether I voted him in office or not. He
Not.
is hired to represent me and my interest. And so he has to have a meeting with me. He has to hear my voice, and it's better that he hears from me versus a pharmaceutical company or a biotech company. They need to hear from patients. And
Okay.
kidney patients are a vulnerable population, meaning
Yes.
that, they may schedule these meetings and some of the patients may not be able to survive or make it to the meeting for
Hmm.
dialysis reasons or just, from not being alive anymore by the time the meeting arrives. And so we're always looking for kidney patients who are willing to share their story, so that we can get these things passed to support and help kidney patients.
Cool. Cool. So since doing that,
Mhm.
have you seen a significant change? Well, I know it's by state because of the representative. So,
Mhm.
um,
It is.
as far as Georgia is concerned, have you seen a significant change? Because I know there's a lot of advocates out there,
Mhm.
and kidney patients out there that's rooting for change. So, what have you seen?
The good thing about the kidney, bills, the good thing about the kidney policies is that these are policies that Republicans and Democrats support. And so
It's bipartisan. Okay.
yeah, these are bipartisan issues, and
Mm-hmm.
so you don't have to fight hard to get someone to support it. A lot of people support these issues, and so that is great.
Good.
I just stick to the kidney stuff, like when I'm having these conversations with them,
Mm-hmm.
and they seem very supportive of it. Obviously, there's going to be some members who, don't want to fund it, don't want to support it.
Of course.
Yes, and there are some people who are, have these crazy views that we see on TV who we don't want to meet with, but we have to meet with everyone
Right.
because there are people who are acting a fool but support kidney policies, kidney legislation. And so you're going to go act a fool about this other stuff, but did you support the Living Donor Protection Act? Yes, thank you, thank you, thank you. And you thank
Okay.
them. Like, thank you
Oh,
for
that's good to
supporting
know.
this thing, for me, for my people. Thank you for supporting this thing.
Right.
Don't worry
Okay.
about like how they're acting about other things.
Because
Focus on the kidney.
kidney disease don't discriminate.
That's right.
Republican, Democrat, Independent,
That's right.
it don't discriminate.
Anybody
So
can have kidney disease. And
anybody.
so you stick to that issue. Like I go up there and I see them talking about different wars and different sexualities. I see it all. They have signs in front of their office like,
Mm.
we don't want to talk about this, basically, but no one has ever said we don't want to talk about kidney issues.
Wow. Wow. That's good to know.
Yes.
And I hope everyone got something out of that because I sure
Mhm.
did. That's really really good to know. And in about another year or so, I'll probably be up there with you, knocking on some doors.
It's not
knocking.
hard. It's really not hard. Like
Okay.
all you're doing, and they coach you on how to do this. Like, so if you get involved with the National Kidney Foundation, the American Kidney Fund, what is another one? NephCure. Like there's so many organizations. You
Hmm.
get involved with them, you apply for a congressional fly-in, that's what they call it. They fly you to DC, they put you in a hotel. They have like a full day where they teach you like how to have these conversations. They teach you what the ask is. So what policies are we supporting this month?
That's
What are we
cool.
asking? Yeah, they tell you everything. And they partner you with like somebody from that organization. Like there will be somebody from the American Kidney Fund. So it's divided by states. And so you'll be at a Georgia table, there will be an Alabama table, a New York, there's all these different tables. So you're sitting at your Georgia group. They tell you like, okay, these are the overall issues that we want to focus on. And then when you get to your table, oh, Senator, Warnock has already supported these, and these, and these. So we're still having the meeting, but we're going to thank him during the meeting for supporting these things.
Right.
Like we have 5 things, for example. We're going to thank him for supporting 2 of these things because we don't have this issue in Georgia. And
Oh,
we're going to
okay.
focus on the things that we do have an issue with.
Okay. Oh, that sounds pretty cool. So
Hmm.
so Christian, you're gonna get sick of me. I'm gonna be in contact with you. I mean, we might make this a every quarter type thing, right? Because I don't want to overload your circuits,
Yeah,
because that is important.
it is important. It is
It's
important.
very
One thing that
important.
we're pushing for right now
Hmm.
is support on the Kidney Patient Act. And so the Kidney Patient Act, basically, if we can get support with this, so there was a change that happened 2024. We were really, really pushing for this bill to get passed, the Kidney Patient Act. We're really pushing for it to get passed. And the reason why is because patients, dialysis patients, a lot of them take phosphate lowering medications like phosphate binders.
Right.
And without getting this pushed or passed, that would change their ability to be able to access this medication.
I
And
heard
so,
about this.
yes, and so it didn't get passed. We had
Mm,
several meetings about it and it didn't get passed. And
mm.
so the issue is that instead of being able to just go to your local pharmacy and get, your phosphate binders, you now would have to get them from a dialysis clinic, for example,
Right.
and you won't have access to all the brands that you normally, are used to taking. Like if you found a brand or a medication that really works for you, you
Hmm.
no longer have access to that. You're limited to what the dialysis center gives you, which could be detrimental. It could lead to death. And that's what we're seeing. We're seeing, a rise in death, from from people not being able to have access to this medication. And so like that's like just one, of many policies that we're up there and we're saying, look, we really, really need you to pass the Kidney Patient Act so that patients can have access to phosphate lowering therapies.
Hmm.
Um, and then you give the reasons why, and then, oh, so you
Right.
didn't pass it. So now all these people are dying. Thanks a lot. And here are
Right.
the stats to prove that. And so we're asking again, like, we need you to pass this. And so it's really easy. Like, whatever company you're representing, whatever organization you're representing, they're going to tell you everything that you need to say, and how to
That's
present
good.
the story.
Yeah, that one I did hear about. I would like to now if you can email me any information about that particular
Yeah,
bill,
I have
please do.
Mhm,
Please do, because it's very, very important. And I want to make sure that we at the Get in Position Foundation, we
mhm,
do our part because the more we come together, more of us come
mhm,
along, it's the better. We can
mhm.
fight. We can fight as a collective. We can get it done. We can
And
get her
it's so
done.
easy. Like, if you don't, like, let's say you don't want to go to DC, you can just write a letter. You can just write a letter to your senator or representative about the issue. And a lot of times, like, it's not as overwhelming as you think. So what will
Mhm.
happen is like the National Kidney Foundation will tell you, hey, we really want you to talk to your members of Congress about whatever the issue is. And you say yes, and then you click on the link, and the letter is already written. All you have to do is put your name, your zip code, and when you put in your zip code, it will prompt like, "Oh, you don't have to know. You don't even have to know who your senator is. You don't have to know who your representative is. You put in your zip code, and bam, it all pops up, and it tells you it's a form. It's already written. All it needs
Yeah,
is your name and your signature.
send me that.
And so I
Send
send you
me
the
that.
link. Send you the link for
Yes,
this one.
please. We
Yeah.
on top of it because those binders are very important. They're very
Yeah.
detrimental to the health of dialysis patients. And
Yes.
there are so many who do not have access to
Mhm.
this medication and some of them don't know that
Mhm.
it's even available,
Mhm.
or why it's not available. So
Right.
they need to do their part as well.
Yes.
So we definitely going to be on top of that. I know I am. Well,
Yeah.
listen, Krista, I don't know about you, but I learned a lot. I
Thank
had a
you. This
great
is great.
time with
Mhm.
you. I hope you did the same.
Yes. This has been great.
Here on the Kidney Corner, you're always welcome to come back.
Thank
Do
you.
you know the next time you're going to DC or
I will be in DC at the Congressional Black Caucus annual meeting next month.
okay? Okay, so all right. So I'm gonna holler at you in October. I'm gonna holler at you in October. Okay,
Okay.
I'm serious.
Okay.
All
Okay.
right. Okay. Now don't be forget who this Craig. Ooh, corner, what? Nah. I
Yeah.
want to know what happened at the meeting.
Yes.
Okay.
Yes. What did we
So
get done?
yeah,
Yes.
what do we get done? And I'll have you back. It'll just be for a short segment, so you can be our.
Legislative advocate.
I like that title. I like that. Yeah, we'll hook it up. We'll hook it up because seriously, again, we're trying to get this information out to individuals who have no clue
Mhm.
as to what's going on. It gets much deeper, folks. And we
Mhm.
definitely have to pay attention to who's making these decisions.
Mhm. Yes.
And we got to put the pressure on them.
Yes.
We got to put some people like myself, I'm not all about being out in the streets, you know, whatever, with my picket sign or whatever. But I'm gonna
Mhm.
do my part.
Yeah. And
I'm,
they
I'm
make it so easy. Like, I will say, like, one thing that's really, really, really important to me, and especially, like, I think you too, based on, what we talked about today, is innovation in transplant medication. Like that is a big, big, big thing for me. And so there isn't a bill or policy per se that I can say, please sign or co-sponsor this when
Hmm.
I go, but like that's just something you can, a talking point. And we need innovation in transplant medications. Like, why is it being roadblocked? Like, why has the FDA not approved anything in like a million years? Why are we taking medications that were designed for kidney transplants that only survive 10 years when kidney transplants survive 20 plus years now,
They
but we're
do.
taking medication that was never designed to be taken this long. We
Ooh.
need innovation in transplant medication. Why am
Mm,
I taking a medication that causes kidney damage when I was just in kidney failure? You
mm.
know, why am I taking a medication that's designed for somebody who had, a different organ transplanted? Like, these medications that we're taking, these are not just for kidney patients. These
Right.
are medications for people who had other types of transplants as well. And that's why they are detrimental for kidney patients because they're not necessarily like designed for us. And why, and why not? Why can't we see innovation in transplant medication?
What? I'm done. I'm, Crystal, you put it down. I'm gonna tell you. I we gotta figure something out. Put you on the team because that's serious stuff.
It is serious
It
stuff, and it
is
affects me.
serious
People are
stuff.
like, "Why do you care about this? You got your transplant." Well, I'm still on these medications, and a transplant does not last for the rest of your life. It could, I hope it does, but, it doesn't a transplant does not last for the rest of your life. And
Right.
so, I need to be out here trying to figure out, like, how we can support kidney patients because 'cause I'm still a kidney patient, I
Right.
still have kidney disease. There is
Right.
no cure for kidney disease. Transplant is a treatment plan.
It's a treatment.
Dialysis is a treatment
It's a
plan. There is no
treatment.
cure.
Right on.
Yes.
Power to the people.
Yes.
To those who can't see me, I have my fist in the air, my right fist in the air.
Yes.
Solidarity. My
Mhm.
sister just put it down.
Mhm.
She just spoke a word. She might
Mhm.
get a love offering. I'll pass around the plate. There it is.
Donate
We
to the Kidney Champion Foundation.
There you go. Do that. Do that. Crystal, it's been a joy. Thank you so much.
Thank
It's been a
you.
pleasure as well.
Thank
You
you.
take care of yourself,
Thank
and we're looking forward to having you back in October.
Yes.
That's a promise. All right, listen, I'm going to put you backstage. Just hold tight for us, okay?
Okay.
All right. Well, folks, listen, I don't know about you, but I'm ready to fight. I am ready to fight. My sister just put it down for us. And don't forget, your life depends upon it. So that's been another great episode of the Kidney Corner. I hope you guys learned a lot. Subscribe to our YouTube channel at www.getinposition21.org. You can also contact us at info@getinposition21.org. And as always, as we sign off, make sure you get in position as it relates to your health. We see you next time, folks. Peace.